to start. I think what I'd love to do is start with our partner video from the Truth Initiative, which is really impactful, and then we'll just dive in.
Breathe in and wonder, is this helping?
Zero cloud.
Breathe out. Now you should feel much worse. Vaping nicotine can actually increase feelings of stress and anxiety. Let's call a vape what it is. It's a breath of stress air. See for yourself, breathofstressair.com.
So that's from the Truth Initiative. Very powerful video. You can find it on YouTube or on their website. I'm going to introduce our session now. Mental health challenges in children, in adolescents, and young adults are real and widespread. As the U.S. Surgeon General Vivek Murthy said, even before the pandemic, an alarming number of young people struggled with feeling of helplessness, depression, and thoughts of suicide, and rates have increased over the past decade. The COVID-19 pandemic further altered their experiences, and the effect on their mental health has been devastating. As we work to protect the health of Americans in the face of a new variant, we also need to focus on how we can emerge stronger on the other side. So as we're dealing with this mental health crisis, youth vaping continues at concerning levels, with many adolescents using nicotine vapes thinking they will relieve stress. This is troubling given the fact that nicotine use ultimately increases stress levels as well as exacerbates symptoms of anxiety and depression. This panel brings together adolescent mental health experts and leaders in the fight against youth vaping, who will discuss the relationship between substance use, nicotine, and mood disorders. This panel will help parents and educators address the intersection of these adolescent public health emergencies and provide information and resources to help. So in order, I would like to introduce Marcy Hertz, who is a senior health scientist at the Centers for Disease Control and Prevention, the CDC, in the Division of Adolescent and School Health, focusing on mental health promotion. I'd like to introduce Robin Koval, who is the CEO and president of the Truth Initiative, the national public health organization dedicated to achieving a culture where young people reject smoking, vaping, and nicotine. And Tamana Patel, who is the director of practice improvement at the National Council for Wellbeing. She served as program director on a variety of national health equity initiatives focused on the intersection of public health and behavioral health, mental health, and addiction, including the National Behavioral Health Network for Tobacco and Cancer Control. So welcome to the panelists. The full bios are on the website if you'd like to go into further depth. But thank you for joining us. So, this is such an important topic, and I'm thrilled that we're starting off our conference with this, because, we hear from parents all the time around the country who want to understand what's going on with their kids. Are they vaping? Is it more than that? So you each have such great expertise. I'd like to just jump in with Tamana and talk about mental health awareness. May is Mental Health Awareness Month. And I think, we've been seeing on TV, we've been seeing a lot of information about that, which is important. We're talking about the youth mental health crisis, but what does this actually mean? Can you explain the issue in a little bit more detail? Ooh, can you unmute? There we go.
I just got unmuted. Thank you. Sorry. Yeah, thank you. Yeah, so we're coming up at the conclusion on the tail end of Mental Health Awareness Month, right? And Dorian, I think you provided a really great foundation to this conversation today, particularly highlighting the Surgeon General's report with this youth mental health crisis. I think it's really important to understand, if we don't already, that almost half of all mental illnesses begin by the age of 14, right? Wow. And 75% of mental illnesses will present by mid-20s, right? And so we also know that about 10%, a little bit more than 10% of adolescents will be diagnosed with a substance use disorder in their lifetime as well, right? So it's a really concerning crisis, right? Especially when we think about the risk factors some of the things that might lead to this, right? I think it's also important to understand that suicide is the leading cause of death for adolescents ages 15 to 19. That is a really horrific statistic to just wrap our heads around, right? And so it's concerning, right? And this is, these are statistics I'm presenting even before the pandemic, right? And I'm going to paint that picture about what we know now, right? And so in short, 1 in 5 youth and young adults will live with a mental health condition. Of those, about half of adolescents ages 13 to 18 live with a mental health disorder, and 22% of those have a severe impairment. What I mean by severe impairment is the disorder is resulting in some serious functional impairment, which interferes with or limits one or more major life activities for them, right?
Right.
And so what happened during the pandemic, right? Well, we know that youth mental health worsened. And that a lot of that had to do with the social isolation, the constant change, the continuous change. We know that a lot of risk factors contributing to worsening youth mental health includes disruptions in routine, experiencing trauma, which could include like a loss of a family member due to COVID, financial insecurity, food shortages, just worrying about COVID-19 and their loved ones, right? And so this worsening of youth mental health directly correlates to greater substance use, right? And so I think these are the things that we really need to understand what's happening, and that we're seeing probably this crisis even worsen more, right? I would also maybe want to offer, how do we think about or consider those who are most heavily affected, which includes the most vulnerable, right? Which could be youth with disabilities, racial and ethnic minorities, LGBTQ plus youth, low-income youth, youth in rural areas, immigrant households, those in child welfare or juvenile justice systems, as well as homeless youth.
Right. Right. No, that's so important. We're going to get into that a little deeper later, because that's a really important point. Now, Robin, these kids, who are negatively affected by the pandemic and mental health are also increasingly negatively affected by tobacco use. Tamana mentioned that, they do have their, 10% of adolescents today will be diagnosed with a substance abuse disorder. But what is known about the impact of nicotine on mental health? And has vaping changed the way kids view nicotine? Does it affect our kids? And we also talk about the chicken and the egg, which came first. So I'd love you to just dive into that, because there's so much there.
There is. Thank you for that question. We were just listening to how severe and critical this mental health crisis is for young people. And what we're really seeing is two colliding crises. So we know that there's still an epidemic of e-cigarette nicotine use among young people. That's being heightened all the time. If you think about how much nicotine young people who vape are getting, I just came upon this statistic the other day. I think it's well known, but there's enough nicotine in every e-cigarette. About a quarter of an e-cigarette pod has enough nicotine to sustain an addiction. And when you think about how much young people are getting and how much nicotine they're getting, and we know, of course, about the physical, cognitive impacts of nicotine on the brain for young people. But what's less well known, but certainly established in quite a bit of research, is the connection between nicotine and mental health. We don't have a causal relationship, so it is a bit of a chicken and egg, as you say. We don't know what comes first and how they impact each other. But what we do know is that nicotine does impact and is associated with feelings of anxiety, stress, depression. And what's so ironic about that, and unfortunately quite sad, is the very thing that young people say they're turning to help with all these mental health issues they're feeling, as Tamana was saying, is actually making it worse. Nicotine is not a stress reliever, it's a stress amplifier. And so one of the things that we really feel is important for young people to understand is if you are feeling sad or stressed or anxious, the one thing you shouldn't be turning to is nicotine. And in fact, you know, when we've talked to young people, we found, and this is in some research, that 90% of young e-cigarette users actually said their mental health improved when they quit vaping. So it's the exact reverse of what the conventional wisdom is. And frankly, why do young people believe this? They believe it because it's what the tobacco industry has spent years and years teaching culture, and of course, young people, to believe that nicotine will help you relax. It gives you pleasure. We've seen, you know, all of the cigarette ads and vaping ads for years and years that suggest that you'll feel better mentally if you smoke or now vape. And in fact, the exact opposite is true. And that's one of the things we're trying so hard to do within the Truth Campaign, is to help young people understand that real contradiction in terms of what the culture and the tobacco industry has tried very, very hard to communicate over the years and what is actually true.
Right. You know, you talk about the tobacco industry communicating, you know, false narratives and, you know, trying to get kids and, you know, priority populations addicted to these products. You know, Tamana mentioned that the vulnerable are, you know, vulnerable populations, you know, LGBTQ youth, low income youth, youth with disabilities, rural areas, in immigrant households, youth involved with child welfare. They are all negatively impacted by the pandemic, but also by mental health and by substance use. And that's again because the tobacco industry is often targeting them. And we know that very clearly from menthol cigarettes and the African-American communities. But Marcy, I'd love to talk about, you know, what we know about the inequities among the youth population, mental health outcomes, and also just, you know, the lack of medical care and substance use.
Yes, thank you so much, Doreen, for having me, and thank you so much for the question. I do want to preface my answer by saying I'm sharing a lot of the data and information that the CDC has collected from young people in schools, but I'm also sharing some of my practical experience as a former school counselor and the parent of a 13 and 15-year-old. So I just want to frame it with that regard. So as Tamana said, we know that youth mental health from our data was really concerning even prior to the pandemic. We've been collecting data across the country from high school students since 1993. And when we looked at trends from 2009 to 2019 on almost every mental health variable that we look at, feeling sad and hopeless for the past 2 weeks, you couldn't do usual things, you considered suicide, you made a plan, you made an attempt, all of those things were worsening even prior to the pandemic. And then when the pandemic hit, right, as Tamana already said, we know there were disproportionate impacts. First of all, we know COVID disproportionately impacted communities of color. And what did that do? That increased stress and anxiety among youth and communities of color, that they were going to get COVID, that someone was going to die or be hospitalized about COVID. So that is part of the framing there that we have about disproportionate impacts. We also resurveyed our young people in the middle of the pandemic to see how their mental health was doing. And we know there that sexual minority youth, almost half of them had said that they had considered attempting suicide. Almost half said they felt persistently sad or hopeless, sexual minority youth. So that's what we know in terms of disparities by sexual minority youth. And there is some data to suggest that racism and experiences with racism also increase the likelihood of experiencing depression or anxiety. And we know that particularly American Indian, Alaskan Native, or people of Asian descent were more likely to report having those types of experiences during the pandemic.
Wow. Now, it's a lot to digest. And from what we've been hearing, children who are experiencing mental health issues are having trouble finding providers who can help them. And many are just going to the emergency room, and they're waiting in the emergency room for for a bed or for a child therapist or psychiatrist. Tamana, we've been through so much over the past few years, and it's true that this mental health crisis is something we've never seen before. But sometimes parents have trouble trying to establish if it's just normal adolescent angst. I mean, how do we know that kids are really having a serious mental health crisis, or are they just being teens? What's the difference? Or are they, how do you know if they're experiencing substance abuse use, or if it's just the normal anxiety?
Yeah. So I think it's important to know, even with the pandemic, we're still wanting to understand and look for the same signs and symptoms, and they may present even more so, right, during this time. And so what those signs and symptoms might include are, are there problems with concentration, the ability to think clearly? What's the appetite like? Are there significant changes in someone's appetite? Noticing feelings, consistent feelings over several week period, right? Are there these immense feelings of sadness, emptiness, hopelessness, or worthlessness, right? Have they lost interest in things that they used to enjoy, right? Is there even more excessive worry than before? What does irritability or restlessness look like? What about the sleep patterns? We've been in, especially in the beginning of the pandemic, we were very isolated socially. What does that look like now? Are they not wanting to be around people or take part in activities that we can in a safe and healthy way given the pandemic? I think the same signs and symptoms we're still looking for, understanding some of it is going to be pandemic related. I would look at continuity, consistency, duration of these signs and symptoms to see if something might be worth addressing with a youth or young person.
Right. I think hopelessness, loss of interest in things that they might have been interested in before. I think that's a really big sign. Feelings of sadness. That's so important. And very often teens hide these feelings. And, I know that you only really find out about it until you've hit crisis level. So, it's very hard. A lot of those qualities, though, loss of appetite, feelings of anxiety, some of those can also mimic substance use and abuse. And, we're here talking about tobacco, nicotine, vaping. Robin, Truth's latest campaign, we saw one of the videos leading into the session, and, there are others, really plays on the factual irony that you think they're using nicotine to cope with stress and anxiety when it can actually make it worse. I think the video was so clear. And it calls out the tobacco industry for having promoted that narrative. So it's not by accident that this happens. So what do we know about the tobacco industry? Historically, and these vaping companies, and their efforts to construct this false narrative, to get kids sucked in.
Sorry, had to unmute myself. Well, this is from the playbook, the classic playbook from the tobacco industry. It goes back 50 years. I mean, if you think of original campaigns like Newport, Come to Where the Pleasure Is, and things like that, this narrative of, tobacco as making things better, more pleasurable, relieving stress. Even think about all of the pop culture that we're all immersed in, but particularly dangerous for young people who are so impressionable. What we see in the movies now, in streaming video, in music videos. We do a report every year. We've done it for 4 years with the title "While You Were Streaming," and what we know from that is images of tobacco, whether it's vaping or smoking, are at increasingly troublesome levels, especially, and this is in our most recent survey, in the kinds of shows that young people watch the most, especially the ones that they binge watch, on Netflix and on platforms like that. In fact, Netflix is the worst offender. That was very much happening during the pandemic, right? Everybody was home watching more, binging all these shows. Many of these shows that have multiple images of young people smoking in ways that look like it enhances mood are shows that are in fact animated. So, I mean, in terms of their appeal to young people, we know that that's out there. And there's research that shows, not only older research that shows that exposure to imagery, tobacco imagery in movies helps to facilitate the use, starting the use of cigarettes. Our research, our more recent research, shows that that same imagery also facilitates young people in beginning to vape, because they choose the nicotine product that's most popular for their group, easiest for them to get, et cetera. But we also know that when we educate young people and when we give them the facts, that's really the foundation of the Truth campaign. That's why we call it Truth. They can make much better decisions, and they do make better decisions. So that video you showed at the beginning is really the second chapter in a campaign we began last fall that we call "It's Messing with Our Heads." That is about the fact that both nicotine and vaping and the tobacco industry, so a little double meaning there, are messing with young people's heads. We started with some work we call Depression Stick, which really came from the premise of, what if the industry really told the truth? What if they called a vape what it really is, just like we came to know cigarettes as cancer sticks, which is what the culture named them. What if we called a vape what it really is, which is a depression stick, because of this association between vaping and nicotine and mental health. The second iteration of that, and continuing with the depression stick idea, is what we call breath of stress air. Because the truth is, every time you take a hit, a young person takes a hit on a vape, they are literally getting a breath of stress air. And when we are finding that when we put the facts in front of young people, they actually are aware, attentive. We see changes in their attitudes towards vaping. And I'm very pleased to tell you, in our most recent research, what we see is that young people who have higher awareness of the Truth campaign are both more likely to not initiate vaping, as well as more likely to not progress in vaping behavior. So the bad news is we still have a big problem out there. We have these two colliding crises, which are very, very serious, and they're sort of amplifying one another. But the good news is that when we tell young people and educate young people and give them the information that they need to have, we can start to reverse that. And I'm very pleased that while we have a long way to go, we're starting to see that happen.
right. I think education is so important because, the tobacco industries are educating our kids to see what they want and on social media, and we'll get to social media in a minute. But we did talk about the youth at risk, and there's a more technical term. It's called ACEs. It's adverse childhood experiences. And public health providers can rate people by the number of ACEs they have, and will kind of show how prone to mental health issues they are and youth substance use. Now, we talk about substance use in general, but nicotine is really classified as a drug. And the new way of consuming nicotine through vaping is very high tech, and you get more than you have before. So Marcy, can you talk a little bit about how we define ACEs and then substance use? How does vaping nicotine either compare to other substance use or even lead into substance use? What's that correlation?
Sure. So for those who don't know, this term ACE, or adverse childhood experience, was really coined in a study in the 1990s where CDC partnered with the Kaiser Family Foundation and asked adults who were sitting in a San Diego Kaiser health facility, hey, can you tell us about these experiences you had before you turned 18? So they asked about these different types of experiences, and they were mainly in two categories. So they asked about direct experiences with child abuse or neglect, and that included physical, sexual, or emotional, and what they called household dysfunction. So it included things like parental divorce, which is fairly common, but it also included witnessing things such as witnessing parental substance use, witnessing domestic violence in the home, having someone in the home with a mental illness, or having someone in the home who was incarcerated. So as you mentioned, Dorian, what they found was a relationship, a very clear, significant relationship between the number of these experiences people said they had before they turned 18 and adult health outcomes, and almost every variable you can think of, including early death and heart disease, stroke, sexual risk, not graduating high school, pregnancy, and illicit substance use and smoking. So the likelihood of that negative health outcome increases. So the negative outcome here would be nicotine use, increased as the number of adverse childhood experiences increased in a very clear, stepwise fashion. We know this from the research. There's been emerging research that specifically looks at the relationship between these adverse experiences and vaping per se. There's been a Canadian study that looked at that found the number of ACEs experienced was directly correlated or associated with an increased likelihood of past 30-day vaping. So all those ACEs increase the likelihood of poor mental health outcomes. And as Robin said at the beginning, it's a chicken and the egg scenario. We do know that poor mental health and vaping are associated with each other. I do want to say, to piggyback on what Robin said, that we need to listen to what our young people are saying. I guess I'm in a place of stress right now because my teens are in the midst of finals now, right? So we do need to pay attention to them saying, I'm feeling stressed, I'm feeling the need to relax, and give them alternative ways that they can do that. Whether that's physical activity, outside, for example, yoga, meditation, but it can also be even something less formal than that. We know from a lot of the studies and research that kids who say they have someone they feel like they can talk to at school or at home, that someone cares about them at school or at home, really can protect them from adverse outcomes, including substance-related use, nicotine, and mental health outcomes.
Right. And getting that positive message is so important from someone, whether it's their parents or, someone from their, their church or their religious organization or school, because otherwise they're getting all of this messaging from social media and from tobacco companies and influencers. And I want to kind of throw this out to everyone. I know, Robin did mention social media earlier, and we have a whole social media panel later in the conference today. So actually that's really great. It's a big part of our kids' lives and their mental health. So Robin mentioned the exposure to vaping imagery. You see it on Netflix, but you also see it on any of the networks. the self-esteem issues that arise from whether it's Instagram or Snapchat, and then even the lack of sleep from being on these devices all the time, which has a causal effect with depression. So are there specific insights or guidelines around social media that we should know, or that parents should really know, to support our kids' mental health? Like, how can they talk to them about this? Anyone want to raise their hand? Robin?
Well, I think the best way to work with kids is, you can't punish your way out of something. You can't take things away. I think being in an adversarial position with your young person on anything, whether it's their use of nicotine and vaping behavior, and their use of social media, is always going to put you in an adversarial position. So while we don't advocate a certain way to limit social media use or anything like that, I think it's all of the things that Marcy said earlier in terms of helping young people to be able to put into perspective what they're seeing, because you're right, the worlds of Instagram and TikTok, et cetera, are, show not the real world. And we've seen study after study, of course, that shows how, young women, everyone, are negatively affected by these sort of artificial worlds and the algorithms that target you. I think the good news, though, is there are also ways to use the digital world to help young people. So, for example, the quit vaping program that we have called This Is Quitting is designed specifically for young people. So it's not a quit smoking program that's just been retrofitted for young people. It is designed to be delivered and work on your phone, which is, of course, where young people are living. It's anonymous, it's text-based. Your mother doesn't have to know, your teachers don't have to know you're using it, your friends don't even have to know. Often friends are a barrier to young people moderating their behavior or wanting to quit, because there's so much social pressure. And what we found is that young people are really, really wanting to quit. So we launched this program, I guess 3 years ago, almost. We have almost 500,000 young people who have enrolled in the program. We know the program works. A study we published in JAMA, a randomized clinical trial with young adults, shows This Is Quitting increased quit rates by 40%. It's very significant. We have a trial going on with teens right now. So, I think the question on social media is a big one. It goes way beyond the scope of vaping and nicotine use. It's one we really care about. But I think part of the answer is also, let's use the tools that young people do gravitate to, and where they do feel comfortable, they live on their phones, to also help them have good behaviors and help them learn how to quit.
Right. Marcy, you had something to say also?
Yeah, thanks for the question, Dorian. I think it's a really pivotal one, excuse me. I do want to note that in the Surgeon General's report called to action on youth mental health, there's a whole section on social media. And I think, honestly, part of the responsibility lies with the social media companies, and the Surgeon General's report calls for looking at that and changes kind of at the system level. But I do think there are opportunities for what we call social media literacy, both in school and health education classes. So I would encourage parents to reach out to their school and find out if there are classes related to that in health education. There's a whole national health education standard related to understanding and being able to critically interpret information to determine its accuracy.
Right.
Also, as a parent, I know there's opportunities every day when you're talking to your children. Sometimes one of my kids will say something and I'll say, where did you hear that? And what did you think about that? And try to process it with them. We do know from the research that parents who do those kinds of things, have those critical conversations, pay attention to what their kids are watching and doing online, that's associated with a lower risk for vaping and improved mental health related outcomes too. So I think it's an important question, but I do agree with Robin painting social media as the Darth Vader and the evil entity out there isn't really helpful either. And for a lot of people, it serves as an important social connection, but just better understanding what they're doing and talking to them about what they're doing and seeing online is a really important opportunity.
Right. I mean, it's our new reality. So we have to learn, how to live with it. And education is so important. I mean, we talk about, beginning the conversations with your kids early. It's super important that you start early. Now, just about nicotine withdrawal and the impacts of nicotine withdrawal that you've experienced in their mood and mental health while they're quitting. We talk about This Is Quitting. It's worked extremely well for many kids. For parents as well. I actually signed up for the parent portion of This Is Quitting, and it gives you tips to work with your kids. So, it's a dual approach. For some kids, it might not be enough and they might need other things to help them along, but it's also a nice addition if it's not enough as a standalone. And we will get into a whole cessation panel again later in the conference. But what about the impacts of nicotine withdrawal and how does it affect their mood and mental health? I'd like to start with Tamana, but then maybe Robin can jump in also a little bit. And even Marcy, I mean, this is kind of something that really so many families are experiencing right now.
Yeah, so trying not to get too technical here, but what we know is that nicotine stimulates that prefrontal cortex. That is the reward system of our brain, right? And what it does is it causes that release of a feel-good chemical, which is dopamine. That is the neurotransmitter that's responsible for these feelings of pleasure and well-being, right? So the acute effects of nicotine wear off within minutes. And so those who use nicotine continue to dose themselves frequently throughout the day to maintain that pleasurable effect of nicotine and to prevent those withdrawal systems. So what happens is when someone abstains for a period of time, they experience irritability, stress, anxiety, feelings of depression, because the brain's not getting that feel-good chemical, right, that nicotine induces. And so that's what leads to these cravings and continued use. What we did see too through another study, it was very small, but really specifically looking at electronic nicotine delivery systems, is that produces similar brain changes to those caused by combustible cigarettes. And so again, super small, the research is still emerging. Marcy might have more to share, but what they found was that when 9 regular users of e-cigarettes had resumed vaping the devices following a 14-hour break, so 14 hours of abstinence, they exhibited some of the same changes in brain function that have been linked to relief from symptoms of withdrawal in similar studies using combustible cigarettes. Right? So there is this negative feedback cycle that is happening.
Yeah, I'd like to add, I mean, because it's one of the things we're really trying to educate young people on as well, is this bad loop of that nicotine withdrawal, addiction and withdrawal causes. It's why there's this perception that nicotine helps with stress and anxiety. But what really is happening is you're medicating yourself every time because as Tamana says, nicotine is a very short-acting drug. You go up right away, you get that improvement in mood, because that is how nicotine feels at first. Mm-hmm. But once your brain gets used to it and you need more and more of it to get to that same point, which gets harder and harder to reach, you feel when you use nicotine that you are less stressed, less depressed, less anxious. But all you're really doing is feeding this, this loop. In fact, one of the videos we've just put out is called Loop, that helps explain what is a pretty complicated process to young people. And I think, you know, the trick is really helping to counter all of this miseducation that the tobacco industry has done for years, by feeding into this idea that what you're feeling is pleasure, when what you're really feeling is the craving for more nicotine, and then the satisfaction, very briefly, of that craving. So that's part of this Breath of Stress Air campaign. It's something that we also try to teach young people. We have a curriculum called Vaping Know the Truth. It's in over 5,000 schools now. Over 400,000 young people have taken it. That's the modules in that are very much, one of them is very much dedicated to educating young people about this cycle of addiction, because it's very confusing. Young people don't know what they're feeling. It's why parents are often so at a loss, because kids get addicted so quickly. These products are so addictive that a kid that seemed perfectly normal 2 weeks ago, in the course of that short a period of time, can become heavily addicted. And that's very different. Even parents who maybe had smoked, became addicted, quit, and think they understand this cycle of addiction, these products work differently. It used to take a really long time to get addicted to nicotine if you smoked a conventional cigarette, because a cigarette was a dose. You knew how much you smoked a day. Cigarette, you can't smoke in many places. You can't, you couldn't smoke at school, you couldn't smoke at work, probably maybe you couldn't smoke in your house. Vaping is totally different. You can sneak it in school, in the bathrooms, but basically use as much as you want. And so kids become addicted very, very quickly. And that is very confusing to parents, because these changes happen like almost overnight.
Right. That's such an important point. We have a panel, youth cessation, and we're going to really dive into that a little bit more, or a lot more actually. So sign up for that afterwards. But this kind of leads into the next question, but then we have a question in the Q&A, which I want to kind of merge with this. And I was going to direct it to Marcy, but how can parents help build resilience in our kids to cope in the current world? And what resources are available to parents, caretakers, teachers, and others to promote mental health and prevent substance use by teaching skills to problem solve? But then this question came in, and I really want to bring this up because I find it so relevant today. And it's a question from someone in Buffalo, New York, that says, in the wake of the mass shooting in the primary Black and Brown community, the community has been traumatized and some have been re-traumatized. Anxiety is high, an increase of fear in parents to send their children to school, etc. There's a disproportionate number of providers to assist the community that look like them. The use of nicotine and vaping has increased based on ACEs prior to this. So she wants to know how to work with block clubs, extended family, faith-based, and those that are interested in a grassroots effort to assist in helpful conversations to build a safe space. So it's kind of a little bit the last question that we had in the panel. How can parents and other community organizers help build resilience in kids and build a safe space?
Yeah, no, thank you for asking the question. And I do want to say that resilience is really more than just the absence of depression and anxiety, right? It's feeling good and productive. It's being able to, as you mentioned, Dorian, cope and problem solve when stress and challenges come up, because that's life. They will encounter them, but how can they use healthy strategies to find their way through? So I think it's an important question. I did want to note about essentially community trauma. And there's a large research on this, which is a separate webinar about historical trauma related to institutional racism and things along those lines, which is a separate webinar. But I would just note that the Anti-Defamation League has a lot of resources for this. I am blanking on the name of their really seminal program that is specifically geared towards communities. No Place for Hate. No Place for Hate is geared towards communities coming
And
together.
we can put this all on the recording in the description. We'll put all the links on. So
Perfect. So it's really geared towards communities coming together in the way that you described. And if there's community readiness and willingness to do that, that is fantastic. That's an important first step. The Southern Poverty Law Center also has some really great resources related to that. But I do think that this is another collective trauma layered upon, as the question noted, a history of collective traumas. But I don't want to paint a dismal picture here. As I mentioned before, and related to your question, Dorian, there's been some emerging research looking at the opposite of these adverse childhood experiences, but looking at positive childhood experiences. So kids who ate dinner with their family 1 or 2 nights per week, who said they had 2 trusted adults that they could talk to outside their family, who felt like their family stood by them in difficult times. Those kids had better mental health outcomes, even in the face of these adverse childhood experiences. So I can't emphasize enough how critically important it is. Again, like dinner twice a week. I know it's hard with kids' activities and things like that, but some of these are just really low-hanging fruit, ways to increase resiliency, shared activities among family members with young people are really critical activities. And again, are things that are relatively easy to do. And there's a whole CDC resource about school and family connectedness that I would encourage you to look at. If you Google CDC and school connectedness, there's a whole guide for parents about ways parents can work collaboratively with schools so that kids feel like they belong at schools. We could do a whole other webinar about the relationship, for example, between bullying and peer aggression and substance use and negative mental health as well. So that's just an important resource I wanted to point out.
Right. Tamana or Robin, do you have anything? I mean, I think connectedness is so important. Empathy is so important. If a parent, you know, it could be a school, to your point, or someone from a faith-based organization. So Tamana?
Yeah, I mean, I would echo what Marcy just offered 100%, right? Family. I know from a needs assessment that National Council did throughout the pandemic, really trying to learn and hear from youth and young adults, is that they identified family as the thing that matters to them the most. And so really being able to carve out that dedicated time through dinners, activities, any space for that is going to be really key and important. I will also offer what we learned from that too, was they told us that the most compelling reason for them to not use any substance is actually this concern of messing up their future. Right. And so, which was a very crucial insight, I think, for us as well. And so how can we create opportunities for them to participate in sports or hobbies or music, family outings, things like that, really prioritizing what they value the most and also helping them think about their future, their ongoing future.
Yeah, the only thing that I'll add, because I think Marcy and Tamana covered it so well, is, you know, one of the things that we think is so important in terms of helping young people overcome a nicotine addiction, especially when they are more vulnerable, as this question indicates, during times of stress, is to understand that they have the capability to do it, because often they don't believe they do. And so that's one of the things we really try to promote. The other thing that I think is really important, and this is part of the curriculum we use, is not only helping young people to understand the problem and what they're feeling and why they're feeling it and how they have been influenced by external forces, the tobacco industry, but also, and this is where the curriculum ends, on a whole module on emotional well-being and self-care. Right. To give very concrete alternatives on ways to feel better. If you're feeling this, do that. Because I think with young people, you know, the more simple, and the better we can break it down and give easy, simple things to do, even on our This Is Quitting program. If you text us crave, so you're feeling like you need a hit on your vape right now, we will text back specific things that all come from the experiences of other young people, and we make it clear that so that there is an alternative. And I think that's very, very important in times, especially like these, where young people are feeling very much at odds, very much stressed, and parents are searching for ways to help because they're feeling the same things too.
Right. And then if you text something, someone asked if there's research that shows that when a teen quits vaping, that all of these negative side effects are abated or are reversed. So is that communicated also through the app or in research on your website, that the anxiety and the stress that's exacerbated by the vaping will calm down, and you give tools, right, to help kids.
Right. Well, for instance, one of the things we're doing right now, this is very specific, is if a young person signs up for This Is Quitting, we have a partner called Breathwork. It's a meditation and breathing app. We are providing young people with a 6-month subscription to Breathwork, which is, all about providing a healthier alternative to get you through that difficulty and give you something that will last you your lifetime. There's even a specific breath that we've created with Breathwork that is really all about the breathing you should do when you feel like you're craving something, to sort of calm your body down, get you past that, because the cravings don't last long. You just have to get past that immediate feeling. So yeah, there are a lot of alternative tools and tips that all of these programs give to young people.
Right. And so, okay, I think we've come to our time. The one last thing I want to say is something that someone mentioned in the chat, which is that the pandemic brought to light the fact that virtual care is now so easily accessible. I mean, we're all virtual here. Providers are offering virtual care. So that's also an option for families around the country. So I just want to thank you all for being here. Your expertise is so valuable for families around the country. We will put the resources that you've all mentioned online on the recap of the session. And, thank you so much. It's very important.
Thank you.
Thank you.